Simon. I live on the south coast of England in a little town called Fareham, near the city of Portsmouth. So this is how my journey started. On a Friday night after work, laying in the bath, like a lot of people do, had the most amazing urge to go to the toilet, which I know doesn't sound very nice, but clearly at the time I didn't realise what was happening, but the kidney tumour had a massive bleed into my bladder, causing discomfort. So, as horrible as it sounds, I had to go in the bath there and then, and afterwards it looked like a shark attack. That's the only way I could describe it. The blood in the water, combined by the two, was horrendous. So as I talk to you now, I've had my right kidney removed, obviously with the tumour as well, which was a large tumour. It was nearly the size of my head. I now stage 4 kidney cancer patient, on cycle 7 of Sutent. It's going very well. I've had shrinkage on my scan before last, and then on my last scan I've had no growth, so it's all going well. So with it being a Friday night, about 8 o'clock, obviously the GP's shut, and obviously the GP will be shut on the Saturday morning. I woke early, obviously didn't sleep a lot at all that night, worried. Went to the NHS walk-in centre nearby, and see the doctor that was on duty, and told them what had happened. And their first diagnosis was a kidney infection. So not knowing any different, I was sent away with some strong antibiotics for the week, and left to see how it got on. So I completed the course of antibiotics that the doctor had given me at the walk-in centre for the 7 days, with no bleeds, no real pain or discomfort. So I thought that was it, we're sorted. Another further 7 days, so 2 weeks later, another bleed. So luckily it was a weekday. I was able to get an emergency appointment with my GP. Went to see my GP, explained that I'd had a bleed 2 weeks ago. I'd gone to the walk-in centre, diagnosed a kidney infection. I'd had this strong course of antibiotics for 7 days. A further 7 days on, I've had another bleed, and here I am. At that point, they said they were pretty certain I had kidney stones, and would make me an appointment with the hospital to have them treated. I was sent away from the doctors thinking I had kidney stones, and was to wait for an appointment at the hospital. My issue become that the bleeding become more frequent. It'd come from like 7 days to 5 days to 3 days, to the point where it was getting to every day. So I'd been back to the GPs, and they said, look, it is kidney stones, you just need to be patient for your appointment. I went away, the bleeding got worse to the point where I was getting blood clots, and the only way I could actually pass urine was by laying down to let the blood clot fall backwards. So I decided it was the time to take a photograph of my urine to show the doctor, because sometimes when I was getting there and they were dipping my urine, it was urine, and they weren't seeing the full extent of the blood at the time of the bleed. So I showed them what looked like a bowl of red wine. Even then, they still never mentioned the word cancer. It was just bad kidney stones, and they would see what they could do to speed up my appointment with the hospital. I've been to the GP, showed them the photograph. Again, like I said, they never mentioned the word cancer. It was still kidney stones, and I was to be patient, and my appointment at the hospital would come through soon. So again, went away. The bleeding at one point become very bad, and even laying down, I was unable to pass urine, which was becoming uncomfortable. So I took myself to A&E for help. They sent me up to the urology to be catheterised. It was the weekend, so all they had was a catheter team on. They helped me over my predicament that I was having at that particular time, but also when I told them my story and said, I've got kidney stones and I'm waiting for my appointment, the nurse at the apartment looked for my referral, found it, and brought it forward a week. So luckily for me, brought my appointment forward to that following week at urology. Following week, I went for my long-awaited urology appointment, hoping for some answers and some help. My name was called. I went to see the nurse first, explained what was going on. She said I was at the wrong clinic. This was a bladder cancer clinic. Again, I was quite shocked. I didn't want to be pushed away. I'm not sure at this stage where the mistake was, whether it was my GP or it was the nurse from urology the week before just trying to help me and put me in somewhere. So I sort of begged my case, explained what was going on, and the nurse agreed that she would send me there and then for a CT scan, so at least they'd have some kind of answers what was going on, and then I could be put in the right clinic going forward. I went off for the scan. It was very quick, and at last, quite happy that felt like something was being done and actually being listened to. Went up for the scan, come back down, sat in the waiting room. At some point, I can't remember how it happened, a different nurse come along and took me to a little room around the corner, which I thought was quite nice. It was very comfortable, very, very relaxing. At this point, still had nothing had dawned on me that there was anything untowards, anything really wrong. And sat in there, and another doctor had come in and just out of the blue said, right, what are we going to do with your cancer? At that point was the first point someone had ever mentioned the word cancer to me. No GP, no nurse, no one. And he knew from the look on my face that no one had said anything to me, and he'd put both feet in it. What you need to realise as well, I thought I'd gone for a kidney stone diagnosis. I'd gone on my own. No one had ever mentioned it could be anything sinister like cancer, so I was quite happy to go on my own. So when that diagnosis was delivered, the way it was delivered, and it wasn't the doctor's fault, because he thought someone had told me, something, the world for that minute stopped, and almost to the point where you look behind you thinking, actually, who's he talking to? Is he talking to me? But he was talking to me. I was the only other person in the room, and it is a cliche, but you think about your kids straight away, you think about your family, and you do think that's it. You hear the word cancer, and that's the end. There's no coming back from cancer. Obviously, I know now that that's not the case, but from that split second, that seemed like a year, that was it for me. My life was over then. I was going to be dead before the end of the year. The doctor very quickly realised what the mistake he'd made, left and come straight away back with the senior consultant and a Macmillan nurse, who obviously sat me down and explained what they'd found. And what they'd found was they'd only CT scanned my kidneys, both kidneys, and what they saw was my left kidney, which was fine, but there was no more right kidney on the image. The image on the right hand side was just one large mass. So even at that point they couldn't even determine how large it was. So that was on a Friday, and an appointment was made for the Sunday for a full abdomen CT scan. And obviously I went back on the Tuesday to find out what they'd found. And what they'd found was a tumour the size of my head, and arranged for surgery 2 weeks later. I left that appointment, went home, knowing I had a very large tumour, that the operation wouldn't be like a normal operation to remove a kidney and a tumour, that I'd have to go through the front in an L shape incision, which would be 15 inches long, so they could remove the tumour in one go. So, and because of the complexity of it, they couldn't do it for 2 weeks until they had all the specialists that they needed in place. So I entered a 2 week, depression zone, crying, lonely, even though I was never alone for 1 minute. Someone was with me the whole time, a family member, a friend, everyone rallied, but inside your head, you're lonely, and you know you've got cancer. They don't know how bad it is until they've got in there and had a look and removed it. At the time they were concerned of the size, what had it attached itself to anything, had it spread anywhere. So you had the fear of how bad your cancer was. You also had the fear of the operation that was coming up and the recovery, but you also had the fear of your family and watching them around you trying to be strong for you, but you could see them breaking as well underneath. Those 2 weeks dragged. They were long and tiring, still bleeding. Obviously the bleeding was getting worse. I never watched so many box sets in my life. The only way I could sleep was with sleeping tablets. Didn't really have an appetite. It's just a long stretch then 2 weeks. It couldn't come soon enough. And you know, I've heard of people waiting a lot longer than the 2 weeks I had to wait for their operations, and I don't know how they manage it. I really don't, because it's a scary place to be, waiting for that surgery you desperately need. And the one thing you're thinking about all the time is the delay making it worse, to the point are you going from stage 3 to stage 4 in that period of waiting. What I did manage to do, from support or pressure, depending how you look at it, from the family and friends, is I did stay away from the internet. You know, everyone said, you know, you'll read stuff you don't want to read, and I'm guessing it's because they've read it themselves. You know, they went straight to Dr. Google and had a look, and they knew it wouldn't do me any good. And I'm pleased I managed to stay away from it, because afterwards, once I thought I was all right, I went and read, and it wouldn't have done me any good at the time. Those 2 weeks were hard enough as it was, without putting that added pressure on myself. So that is one bit of advice I'd give anybody: stay away, because it's not all true. You know, listen to your consultant. If you have a question, speak to your consultant about it, not the internet. You know, because it won't help. The Tuesday, the 17th of February, come around. It was operation day. I had to be there at 6 o'clock in the morning for pre-ops. You know, all the stuff. I have to do blood tests, cannulas, all that sort of stuff to be fitted. My operation wasn't actually to 11. Obviously, I went up an hour before. So it was 3 hours, sat with my wife in a little room together. And it was a nice 3 hours. You know, we felt that we'd come to that point in our journey where something was going to get done, was going to be amended, and was going to move on. So 10 o'clock came, the porter come, took me up. I had to have a pre-op first. I can't remember what they called it, but basically my tumour had quite a large blood supply of its own. So I went to like a mini operation first, where I was awake, but my area around my groin was numbed, and they went in up through my groin, and I could see it on like the monitor, and they literally cut all the blood supply to the tumour and sealed them off. The reason they said they did this, because if they had done that while it was an open operation, there was a strong chance that I could have bled out. So they like to do that while it's sort of still closed up, if you like, to get that part done. It took a lot longer than I thought they would. The anaesthetist actually come down at one point to find out where I'd got to. It was starting to become uncomfortable and painful, which he could see in my face. So as each blood supply was cut off, the pain was getting a bit more and a bit more. And so he said he would have some pain relief waiting for me when I got upstairs. The theatre nurses were waiting for me to take me up. So this was just gone 12 by now. And then obviously I don't really remember much, but after that, obviously put me to sleep, and then the operation took 8 hours. I have vague memories of the recovery room, of people trying to wake me up and stuff like that. And then I went to high dependency, where I spent for 2 days, where I have no memory of those 2 days at all. My first memories after the operation was when I went back to the main ward. My stomach was heavily bandaged. I had a morphine driver. I had a catheter. I was catheterised, obviously bedbound. Very sleepy and very painful. This very large incision. Sleeping was an hour at a time. Eating, didn't feel like eating. I was throwing up. But all that felt worth it, knowing that cancer had been removed. On the third day, when I was a bit more with it, the surgeon come and see me who performed the operation. He was very confident that they'd removed everything that needed to be removed, and the prospect looked good for the future. I spent 7 days in hospital, recovering. The only downside was, and to be too graphic about it, I couldn't poo. I was bound up quite badly, so that was the longest. I could have probably gone home on day 6, but I couldn't poo, and to be honest with you, I lied on day 7 and said I had, just so I could go home to my own bed and my family and that. And it wasn't until probably day 12 that I finally managed to poo. So those of you who are going through this operation, be aware. So back home, district nurse visited every day for the first week. Changed my bandage. It was nice to see the wound. The wound was very clean. It's a bit weepy at each end. There was no stitches, no staples. They were all internal. I had one little tiny bit of stitch poking out sort of the middle of the wound, so I was very pleased with that. It was healing nicely, so no issues there. So the recovery, although slow because of the size of the wound, it was good. It was okay. I see the consultant back in hospital 3 weeks later, who reaffirmed that they had got everything, that I was now cancer-free, but they would scan me every 3 months for at least the next 2 years, because it was an aggressive stage 3 cancer that they'd removed, and just wanted to keep an eye on me. So went back to work after about 4 months, on short hours. Work were amazing and still are. I've been supportive all the way through, which has helped amazingly. I couldn't have done it without them. So obviously the first scan 3 months later was a big milestone, because even though you've been told it was all right, to actually have a scan afterwards and get the results, everything was all right, is amazing. A great feeling. So I went on merrily, getting fitter, starting to run. I'm enjoying life again. Every 3 months, having that scan, getting apprehensive as the result day come up, getting the all clear, through to January 2017. Again, thought it was a routine scan, go and see my consultant, usual joke, sent away 3 months. But when I walked through that door and I see his face, I knew there and then it was bad news. He hadn't got up and greeted me like he normally did. He looked like a beaten man, and he didn't even need to tell me. I knew that the cancer had returned. That's where my journey ended with urology. It had been 2 years with them, getting to know them very well, but there's no more that urology could do for me. It was now on to oncology. He'd already spoke to the oncologist, so I knew who it would be, and an appointment was made for 2 days later to go and see my new specialist, and discuss the options. It was a nice appointment if you can have one. It lasted an hour and a half. She was very informative. She made it very easy to understand. I was never rushed. Every question I had, she had an answer for. And she felt that the right course of treatment for me at that point was Pasipinib. So I started Pasipinib that night, but it would quickly become aware that that wasn't the right drug for me. I was getting really bad side effects, the sore mouth, diarrhea, but worst of all was my liver function. I'd gone really yellow jaundice. Liver function blood tests were really bad. So first of all, I went from 800 milligrams down to 600 milligrams. With still no real improvement, and ended up at acute oncology quite poorly, with high temperatures, sickness, obviously diarrhea still, looking very yellow. So it was decided then that I would stop treatment and a new medication would be discussed. We agreed on Sudent, but on the middle dose of 37.5 milligrams, because of the issue I had, they didn't want to start me on 50 milligrams. So I've been on that now 7 cycles, so each cycle is 6 weeks. I do 2 weeks on, 1 week off, 2 weeks on, 1 week off. It's felt that 4 weeks on and 2 weeks off wouldn't be right for me because of the issues I'd had with Paspanib. So I did 3 cycles, had a scan, and there had been a shrinkage, quite a large shrinkage as well, first time, which was amazing. You know, best news I had in such a long time. I left there floating, realising that yes, the side effects are not great, and they do affect the quality of your life, but it's worth it. You know, it's worth those diarrhea nights, those sore mouths, you can't eat curry no more, toast hurts sometimes. It all felt worth it, knowing there was shrinkage. So a little while ago I had my second scan while on Sudan. Again, I didn't have shrinkage this time, but there was no progression. So again, it still feels all worthwhile. So I'm looking forward to the future, and hoping that this medication continues working for as long as possible. For me now, with the side effects, it's basically time management. I have to manage my time. I have to listen to my body. If my body tells me I'm tired, I need to take that break. I need to have that rest. You know, I need to cancel those plans if my body's telling me to. My immune system's very low. I catch everything that's going. So my family and friends are very good, and they'll warn me if there's an illness in their house, and, you know, to stay away, don't come over. But I don't let that stop me doing stuff like going shopping or the cinema. I'm careful, but I don't let it stop me, because there'd be no point going for all the treatment just to sit in these 4 walls and have no life. So I still work. My work are brilliant, so I can work from home when I need to, but I still work. I still have my children every other weekend, and we go to the cinema and stuff like that. I've been on holiday. I've had a lad's holiday to Benidorm. I didn't go out every night like they did. I managed my time, but it's worth it. It's worth managing your time to have some kind of life. My message to you all is, don't let cancer ruin your life. Don't let it rule your life. Don't let cancer distinguish who you are, because you are still you. Be careful, manage your time, and you will get through it. It's a journey. It's not a race. It will take as long as it takes, and there'll be other ups and you'll have downs, but you will get through it. So good luck with your journey. All the best for the future.